Hi, everyone. Welcome to our first session of AskaDoc. We are here from the Alzheimer's Association to share some information about COVID and Alzheimer's. My name is Hadia So, and I'm here with my colleague, Riley Hulsman. We are program managers at the Greater Indiana chapter, and we are pleased to invite Dr. Sophia Wang to share a little bit about her knowledge on this topic. So Dr. Wang, if you could tell us a little bit about yourself.
Okay, great. Well, first of all, Hadia and Riley, I want to thank you for being a guest on your show. And I want to extend a heartfelt thanks to all of our essential workers, such as our healthcare professionals and emergency responders and people working in grocery stores and lawyers. So I want to thank all those people. So my job is that I'm a geriatric psychiatrist. And what a geriatric psychiatrist does is that they work with people who are older, who have memory problems, such as Alzheimer's disease and other dementias. And they also work with people who have mental health concerns, such as depression or anxiety. So my main role is the core leader of the Outreach Recruitment and Engagement Core at the Indiana Alzheimer's Disease Research Center. We are one of 35 institutes that are funded by the National Institute on Aging, specifically focused on how to find a cure and to prevent Alzheimer's disease.
Awesome. Well, thank you so much for coming on our show today. As we mentioned, the premise and why we're doing this is because we've gotten a handful of questions from our communities in the last couple of weeks. And we thought, what better of an opportunity to get these questions answered than to partner with one of our local physicians to kind of go through our list of questions and see what your thoughts are on them. So just going right into the first one, how can someone with Alzheimer's disease present with COVID-19 differently than someone with without a form of dementia?
So that's a great question. First of all, we're still learning about all the symptoms of COVID-19. It is a brand new virus, and I really urge people to go to the CDC website to keep up to date on that. Probably the most common symptoms people have noticed are fever, cough, shortness of breath, and some people don't have any symptoms. But in my experience, what we're seeing is that many older people are affected by this disease. That's very unfortunate. And people who have dementia or memory problems often can develop what we call worsening confusion. And that's what we call delirium. Now, delirium is something that we can see in all patients with Alzheimer's disease and other dementias if they have an infection. That's not specific to COVID-19. And so most caregivers may notice before someone develops the physical symptoms that people with dementia can be more confused or start to have more behavioral problems, such as aggression, or they may be much more tired. And so if you start to notice these symptoms, it's important to start paying extra attention, because we know that in older people, especially with dementia, that the symptoms that affect the brain often come before people can even detect fever or other physical symptoms. So that is probably the major difference for people who have Alzheimer's disease and dementia in terms of how they present with all infections, including COVID-19.
Thank you for that distinction. Now, if my doctor has stopped doing face-to-face visits because of COVID-19, how do I get care for my loved one who has Alzheimer's disease, or how do I get a diagnosis?
That's a really great question. So right now, a lot of doctors are obviously limiting their care for safety reasons. If you already have a loved one with Alzheimer's disease or another dementia, and they're having symptoms, I would urge you not to take them to the doctor's office, but to call the doctor's office first if they're not having one of the emergency symptoms that the CDC website notes. And there's a very good list there. And I would just urge people to go through that list and actually just keep it posted on your refrigerator. I'm not listing all the symptoms because it keeps on changing, as we said. If they're having just mild symptoms, again, a call to the doctor's office is appropriate to try to determine what the next steps are. And for non-urgent concerns, like, needing a medication refill, again, a good idea to call your doctor's office. Maintaining the social distancing is key. Getting a diagnosis of Alzheimer's during this time, that is a real challenge. There's no question about it. And I think the most important thing is, you know, talking to your doctor, recording the symptoms, but also turning to associations such as Alzheimer's disease. Most doctors do rely on their loved one to describe the symptoms, see whether someone has the Alzheimer's disease diagnosis. So even though doctors aren't going to be maybe right now making new diagnoses during this time to ensure everyone's safety, if you're noticing a lot of the symptoms that the Alzheimer's Association is having on their website, including memory loss, significant behavioral changes also accompanying that memory loss, it is probably a good time to still talk to the doctor, your doctor. They may not be able to make that diagnosis without seeing them, just to be sure, but it's at least worth a discussion for that. And I would encourage people to reach out to the Alzheimer's Association.
Great, thank you for that. You mentioned CDC guidelines in that last message, and this question has to do with that exactly. Says, I'm having trouble getting my loved one with Alzheimer's disease to do social distancing or to wear a mask per those CDC guidelines. How can they keep their loved ones and themselves safe from COVID-19?
Yeah, so this has been a real challenge. I have a lot of caregivers who say they won't keep their mask on, they don't understand what this is, they try to explain what COVID-19 is, they can't get them to wash their hands consistently. It's definitely a challenge. So I think the first thing is trying to keep the environment safe. So trying to take, you know, we do encourage people to get out and take walks if your neighborhood is safe. So trying to go at hours in which people are not around, preferably very, you know, earlier in the morning. That's a good way to do it. One of my other friends, what they did is that they would take their loved one and they would drive them to a neighborhood in which there weren't many people, and they would take them for a walk around there if you're in a very crowded neighborhood. So I think just trying to take them out during hours of the day so they can get their healthy stretches and exercise when there's less people around, because it is very hard to force someone with a memory problem to keep their mask on. It's probably a little bit easier to get them to wash their hands, but washing hands is always a challenge. What I suggest to caregivers is that they find like a really good video or some kind of game that they like to play with. Some people like to play games with their iPads, and that they help them wash their hands while they help distract them. So that can often help, because washing your hands for 20 seconds for anybody, dementia or no, is definitely a challenge. So those are some small tips that people have found helpful.
Now, one thing about being home right now is that we miss our loved ones, right? For someone who says we've tried FaceTiming and we've tried Skype with our grandchildren and our children, but it's not working, is it safe to have children and grandchildren visit, to come over the house?
Yeah, that's a very tough question. A lot of people have switched to remote platforms like this, but some older people, especially with memory problems, they're not able to make the jump. And then I've had some caregivers who said that seeing their loved one on the iPad or Zoom, it's actually very confusing for them because the person isn't physically in the room. So it can actually even cause them to be agitated. So everybody responds differently to these mobile and remote platforms. So social distancing is really key to making sure your loved one doesn't get infected. I'm sure people have seen in the news that people with dementia and nursing homes and assisted living facilities this is spreading like wildfire because this is a very vulnerable population. But it's also important to maintain that social contact, because a lot of the caregivers I've spoken to, with their social routines being disrupted, they're used to having the grandkids and their children come, it's very confusing. There's a few different ways to approach this, and it depends on the stage of the disease and the person you're working with. Phone calls, they work great. Some people are also writing letters. That's another one. But also depending, like, you know, if you have a backyard that's large enough, you can keep your loved one inside the house, but open the window and they can talk to them and they can wave hi. Because you know, I have two young children, 6 and 9, and explaining social distancing to a young child, it depends on the child. And every child wants to naturally go up and hug their grandparent, and they mean the best, and it's very normal behavior. But as we all know, unfortunately, young children can have the virus, but they may look perfectly healthy and fine. So it is important to still follow those social distancing guidelines. A little bit of creativity can go a long way. And I've had some people say they They've taken out the tape measure and they've measured out 12 feet or whatever on their lawn, put the chairs there. Everyone sits there and they open the windows and they chat on a nice day. So it is still possible with safe distancing to maintain social contact with your loved ones if the Skype thing's not working, the FaceTime is not working out. So those are some of the solutions that actually my caregivers have shared with me. That brings me to another important thing. It's really crucial, I think, at this point to go to those caregiver support groups, because a lot of these creative tips don't come from doctors. They actually come from other caregivers who are developing these ideas themselves. So one of the great things about going to these caregiver support groups, such as with the Alzheimer's Association, is that you can get a lot of these little tips and tricks on how to make it through this time. And I think that's the most important thing. If one thing that doesn't work, you can ask somebody else in a group. They maybe have another idea for you to try. So that's the really big thing, is just keep on staying in touch, but figuring out new ways to do it safely.
I love that you shared all those creative ideas. It seems like on the news and in different outlets, you're finding all those different innovative ways to stay connected, and it's really inspiring. I even saw a tic-tac-toe game on a window, a picture of that, so that was really unique. The last question I have, my loved one needs to be admitted into a facility, but they're not taking any new admissions due to COVID-19. How can I manage this responsibility?
That's one of the biggest questions I get all the time. A lot of people were waiting for admission or a memory care unit, and sometimes these waits can be a few months, and COVID-19 happened, and now they're not taking anybody. I wish I could say there's an easy answer. There isn't. I think one thing that's really key is that obviously it was caregiver distress that led to them, needing to get those admissions, and I really urge them to all go to the support groups and get the help they need. If there's significant, if your loved one with Alzheimer's disease is experiencing significant agitation and aggression, is what it's really crucial that you keep talking to your doctor. If you've tried the tips and tricks that don't involve medication, those aren't working, it's time to talk to your doctor over the phone to figure out some medications perhaps to try out, again, under a doctor's guidance, that may help manage some of these behaviors until they can get placed. And again, I think a lot of people are just, broadly speaking, they're seeing a lot of increase in behavioral symptoms because of the changes in routines, people not being able to go to adult day healthcare. And so I think the one thing that's really important is, as you wait during this time, to try to give a regular schedule. It might take a couple weeks for them to adapt. And again, that's where I think going to the caregiver support groups and finding schedules and routines that work with your loved one, trying out some things, but also making sure it's the same and works well for you, is really, really crucial. And to, most importantly, get the support you need while we wait. Hopefully, things will, testing will be up soon and things will get resolved soon, but we do know it's not going to happen, immediately in the next few weeks. So it is really crucial that you get that support if you're having someone that you're waiting to get placement for. You need to get that support.
Mm-hmm. Thank you, Dr. Wang. This was terrific. I can't believe how informative it was. Now I'm thinking to myself, like Riley said, all the ideas you shared, I need to get more creative on how I can see my family, right? So we really appreciate you coming on to share this knowledge. Is there anything else you'd like to add before we go ahead and close out?
Yes, I think the most important thing I want to say is that there's 3 effects we're seeing from COVID-19. We've talked about the medical piece, but it's obviously affecting people's finances and economic situation. There's no question about that. And those 2 things are affecting people's mental health. And so I want to urge everybody to reach out, especially if you're experiencing mental health symptoms, to go get help. There's nothing to be embarrassed about, and it's very, very important. Especially if you're a caregiver, the evidence shows the better you take care of yourself as a caregiver, the better you can take care of your loved one. So I want to urge people to not be embarrassed and to actually know they're doing the right thing by taking the right steps, by taking care of themselves. It will allow you to be a better caregiver, to care for your loved one during this very difficult time, and to reach out to resources like the Alzheimer's Association in the Indiana Alzheimer's Disease Research Center. We're all here to support you during this time.
Awesome. Thank you so much for that last sentiment. To echo what she said and reaching out, there are numerous amount of ways that you can reach out to the association or to the website that she mentioned below. If you go to alz.org, you can see all the resources that we have, questions that you may have about dementia. And if you go to alz.org/Indiana, you can get a bit more of a deeper dive into what our Indiana chapter is doing specifically. Now, we hope that this isn't the last AskaDoc session that we get the chance to do. We're so thankful for Dr. Wang to be our first guinea pig in this adventure. But if you have any other questions as a viewer today, wondering what we can do, or just any question in general, feel free to let us know that. Both Hadia and myself have put our emails in the bottom left-hand corner of the video. Feel free to reach out to us that way, or if anything, call our helpline number if you are experiencing bigger questions or anything in general. It's 24/7, 1-800-272-3900. But thank you so much for joining us today.
Thank you, Dr.
Thank
Wang.
you.
Have a great day.